It was a horrible operation. And then there were these little absorbable tacks that came out. And they had this bad reaction. Anyway, it's been quite an evolution, and now we've swung the pendulum back, and we're very careful about what we operate on, and I think rightfully so. But our outcomes in our throwing athletes, if we decide we're going to repair labrums, aren't very good. We cause biomechanical changes in these shoulders when we operate on them. If you have an associated rotator cuff tear, as Tom pointed out, the results are even worse. Terrible return to play, 12% in the hands of extremely highly skilled orthopedic surgeons. And slap repairs, like I said, do affect pitching mechanics. So, what about biceps tenodesis? Well, a subpec tenodesis doesn't appear to affect your mechanics. So maybe that's an answer for some of these problems. Our imaging doesn't help us very much at all. There's no correlation really between what it looks like on an MRI scan and return to play rates. So that's kind of challenging. So, we're kind of left with our history and our physical exam to help us make these decisions. And this is a great study from Dave Lintner demonstrating about 50% success non-operative treatment of SLAP lesions. So, really all of us are taking a non-operative approach initially on almost all of our athletes. So why would we leave it alone? Well, it's a purposeful adaptation to physical demands. It's very common in our pitchers, and it does provide increased horizontal abduction and neighbor, which allows guys to generate more velocity, which allows guys to get guys out and allows them to have a higher paycheck. So it's very important, for these athletes. A repair, if you do fix them, you got to be careful. It can undo our normal adaptation and further tearing